Now that we've looked at handling, stowage and the segregation requirements of dangerous goods, let's consider how crew members should respond to an incident involving dangerous goods. Included in the supplement to the IMDG code, the Emergency Schedule or EMS consists of a series of tables or schedules that provide guidance for emergency response procedures. The tables cover spillage and fire. The emergency schedules for spillage consists of 26 tables, each for different types of hazardous substance, ranging from SA, toxic substances, to SZ, toxic explosives. There are 10 emergency schedules for fire, including FA, which is the general schedule. The other 9 are specific to fires associated with various hazard classes. It is important that the general guidelines for fire and spillage described in the EMS guide are also consulted when using the emergency schedules. In the event of a fire or spillage involving dangerous goods, it is important that your onboard emergency procedures are followed closely. This is likely to incorporate the use of the EMS guide. But how is the EMS schedule used? The emergency schedule is used by following 3 steps. First, identify the UN number and proper shipping name of the goods. This will be found on the labeling and placarding of a tank container or from the special list or cargo manifest if packaged goods are in a container. Next, go to column 15 of the dangerous goods list and obtain the emergency schedule code for fire or spillage. Finally, go to the EMS guide for the appropriate fire or spillage schedule for action required to deal with the incident. Now that we know the process, let's consider an example. You are transporting a cargo of lead perchlorate solution, UN 3408, packing group 2, when leakage occurs. When we look at the dangerous goods list, we see that the EMS spillage code from column 15 is SQ. When we go to the EMS guide, we find this information when we reference the code. You can then follow the general guidelines and contact the superintendent or emergency contact person to obtain expert advice on dangerous goods response measures. In addition to responding to an incident involving dangerous goods, there are also several reporting procedures that must be followed. MARPL requires a report to be made when dangerous goods in package form are lost overboard, or probably lost overboard from containers and portable tanks, or there is a risk of them being lost overboard. There are 2 types of reports that might need to be made: a dangerous goods report and a marine pollutants report. A dangerous goods report must be made when there is an incident where lost packaged dangerous goods could endanger persons or the environment. A marine pollutants report must be made when those dangerous goods are marine pollutants. These are referred to as hazardous substances for reporting purposes. Go to Reporting Procedures Appendix Section 2 to see the standard reporting format and procedures in the supplement to the IMDG code. Where goods have been lost overboard, but there is no risk of further dangerous goods being lost, you need to complete the cargo details in section Romeo of the Dangerous Goods Report. However, if there is a risk of further dangerous goods being lost, or in the case of probable loss of hazardous substances, then you must also complete section Papa. Section Papa and Romeo require specific details to be entered. Both Papa and Romeo sections require the correct technical name or proper shipping name of the goods, the UN number, the IMO hazard classes, and the names of the manufacturers of the goods, when known, or the consignee or consignor. You must also identify the types of packages, including identification marks, and specify whether portable tank or tank vehicles, or whether freight containers or other transport units contain packages. This must include the official registration marks and numbers assigned to the unit. You will also have to give an estimate of the quantity and likely condition of the goods. With Section Romeo, you will also have to give information on whether lost goods floated or sank, whether loss is continuing, and the cause of the loss. The reports are made to the nearest local or government administrations for coastal states. The list of national operational contact points responsible for safety and pollution prevention response is kept updated by IMO circular 4 times a year. A copy of this needs to be on board and should form part of the ship's emergency response procedures involving loss of dangerous goods. As we have already said, dangerous goods can be harmful to human health, and so it is important to know how to respond in the case of a medical incident involving dangerous goods. Crew members may be affected by dangerous goods by inhalation of toxic or corrosive vapors, physical contact with or ingestion of hazardous materials. There are a number of signs that someone might have been exposed to hazardous substances, including breathing difficulties, confusion, chest pain, vomiting, shock, and bleeding. In these circumstances, you can find medical advice on board in the supplement to the IMDG code, in the Medical First Aid Guide for use in accidents involving dangerous goods. You may also find specific advice on emergency response after exposure to hazardous substances in the Dangerous Cargo Transport document. Let's take a few minutes to look at how to use the Medical First Aid Guide for use in accidents involving dangerous goods. This uses a simple 3-step process to identify the course of action to take. The first step is to identify the emergency action and diagnosis, using the decision tree. This gives ready reference to treatment tables based on the symptoms shown. You answer yes or no to a series of questions about the patient's observed condition. An answer no takes you to the next question down, where an answer yes takes you to one of 20 numbered treatment tables. Once you have found the right table, the next step is to identify the treatment table based on exposure to specific chemical types. Each table provides comprehensive details of treatment for various signs and symptoms. In some cases, this will include the follow-up treatment required. Lastly, you will use one of 15 appendices that provide general details of procedures for dealing with first aid injuries and emergencies associated with the contact of chemical substances. Appendix 15 provides cross-reference to treatment tables for specific substances that require special treatment based on their UN number and proper shipping name. Now that we know how to use the Medical First Aid Guide, let's consider an example. A crew member has reported that his hand is very red, swollen and painful, with significant blistering. On examination, it appears to be a chemical burn. The crew member has been close to a leaking container of UN 1790 hydrofluoric acid with more than 60% hydrogen fluoride. Our first step is to follow the emergency action and diagnosis to identify the appropriate treatment table. When we answer yes to has the skin been contaminated, this takes us to Table 8. Table 8 provides information on the treatment of skin exposure to chemicals. The treatment table also refers you to Appendix 8 for more specific treatments for dealing with skin exposure to chemicals. It also tells you to go to Table 16 if there has been exposure to hydrofluoric acid, as this is a chemical that is particularly corrosive to living tissue. In the event of spillage or leakage, you should always think safety first, and be aware that dealing with chemical fires or spillage requires specific procedures involving hazard protection measures. You must avoid contact with dangerous substances at all times and do not walk through spilled liquids, dust or powder. Keep away and upwind of any vapors or gases. If at sea and possible, turn the vessel so that the accommodation block and bridge is upwind. Follow the advice given in sections 6 and 8 of the safety datasheet, or follow the emergency instructions in the EMS guide or those provided by the consignor. Crew members must wear protective clothing suitable for contact with the hazards presented. They must also wear self-contained breathing apparatus. Finally, check with the IMDG code and your company response procedures for advice. Before we move on to the next chapter, let's consider some questions. A portable tank container is lost overboard in heavy weather. According to the Dangerous Goods Manifest, the details are as follows. Which of the following reports need to be made? Select as many as you think are correct. Small packages of UN 3020 organotin pesticide, liquid, toxic, packing group 2 are found to be leaking. The cargo is stowed in a hold under deck. According to the IMDG code emergency response procedures, which of the following is the appropriate emergency action to take? Select 2 correct answers. A crew member reports that they have inhaled a chemical substance and are showing severe signs and symptoms of breathlessness and wheezing. According to MFAG, which of the following are appropriate treatments? Select 2 correct answers. What hazard is the crew member exposed to in the image shown?